the GOP as, quote, the party of health care. His administration's position on the Affordable Care Act court case could jeopardize health coverage for millions of Americans. Let's take a look at Medicaid, what it is, who it covers, and how its expansion has been critical to the health of many people in this country. Medicaid serves more than 65 million Americans as of December of 2018. That's about 20% of the entire U.S. population. It serves several groups, low-income individuals with families and children, including the disabled, pregnant women. It helps some elderly Americans pay for their Medicare premiums. It's got a range of mandatory benefits. Here are a few of them: inpatient and outpatient hospital services, home health services, physician services, rural health clinics, which is really important, family planning, x-ray services, along with pregnancy services as well. In 2013, nearly 24 states took advantage of the Affordable Care Act's Medicaid expansion program, covering nearly 4 million uninsured, mainly low-income Americans. Now, over the past 5 years, more states have followed suit. Today, 31 states have expanded Medicaid benefits to their now eligible residents, driving down the rate of people who are uninsured and giving more people access to more than just emergency care. This is really important for health outcomes in the end. But if the Trump Justice Department stance is affirmed by the courts, 12 million people who are currently on Medicaid could lose their access to health coverage, again, adding new stresses that used to be in the healthcare system back into the system. Join Kavita Patel, who's going to have a mic that works because mine just fell apart. Hold on a second. Give me a second there. All right. Kavita Patel. Let's see if we've got that mic back. Do we have it? Can you hear me? Yeah? Okay, good. Sorry about that, folks. Kavita Patel is a practicing physician at Johns Hopkins Medicine. She helped draft the Affordable Care Act during her time in the Obama administration. Kavita, thank you for joining us.
Thank you for having me.
I always want to make a distinction between the two important things that people know about Obamacare. One is that it helped people who had pre-existing conditions, who didn't have jobs, get insurance at a manageable rate, insurance that would cover certain basic things. And the other is the expansion of Medicaid. Some people tell me they think the Medicaid expansion is actually the bigger deal.
Oh, yeah. I mean, I certainly agree with that, especially when you think about the Medicaid. People forget it's not just that Medicaid expanded. It's all the services that you described that go with that expansion. And really that offers states, honestly, think about it this way. It offers states more infrastructure to do better health in general.
Right.
So when hospitals can take patients and they actually have decent insurance, those hospitals actually invest in their own infrastructure. And that's something that, you know, it's hard to kind of put that on a slide.
Right.
But it's what you're seeing around the country when you see more and more people saying, hey, we want to help you get access to better mental health.
Right.
We want to get pregnant women, you know, treatment for opioid crisis.
Right, because if more people are covered for those basic things, facilities will be better, there will be doctors, there will be x-ray machines and MRIs. There are certain parts of this country where those basic health services that I listed are hard to come by.
And would not have existed if it were not for the Medicaid expansion.
Yeah.
I mean, the irony is that this is the best of like a free market economy in many ways. And in fact, some of the largest business deals are going on in Medicaid. I mean, people are in the private sector are kind of doubling down on this.
Let's talk about another piece of this, and it's not the Medicaid piece, but it's the insured piece. A lot of what we're hearing from Donald Trump is insurance that will be offered for lower premiums. And I feel like premiums in a vacuum are not the conversation, because if you can sell people insurance that doesn't cover things that they might actually need, I could probably sell you insurance for $10 a month. Under Obamacare, there was something called essential health benefits. Let's put that screen up that we just had up of the essential health benefits. Outpatient care, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health, substance abuse, prescription drugs, rehabilitative services, lab services, preventative and wellness services, and pediatric services. Here's the thing. You couldn't sell an insurance policy under Obamacare if it didn't offer some coverage of all of these things.
Correct. That's right. And you even couldn't do like what the Trump administration calling short-term plans, which now they've allowed for them to be not short-term anymore. You know, you still had to have certain coverages after a certain period of time. So your point is exactly right. I mean, it's almost like that thing that, you know, probably your mother told you, you're like, you get what you pay for, in the sense that we do need to keep costs down. So there is fair criticism, which is totally separate from the conversation that's happening today about how can we make healthcare more affordable. But it is called the Affordable Care Act. It actually is ironic because care would not be as affordable as it is, even though we need to do better, if we didn't have the ACA.
Because of what? Is it because of these risk pools? Is it because you get everybody in,
right,
and they get covered for all the same things?
Correct.
So some people are not going to suffer from that list of things that I've got on there,
yes,
but their premium helps the coverage for those who will.
Yeah, and also in addition to that, the Medicare program, there were a number of changes to the Medicare program that actually has saved the Medicare program money. So if you think about it all in, it's not just one silo. Medicaid gets expanded, but you actually have like even benefits across everybody, including employed people.
Right.
And then you have the Medicare program, which generally takes care of people over the age of 65, and that program is now more efficient. So, theoretically, that's how you get a little bit of this efficiency of scale and get lower premiums. And in fact, the cost growth of healthcare has been slower.
Right.
And we know that that's something that we can directly point to the Affordable Care Act.
Right. You want slower cost growth, better outcomes, and it was a direction in which we were heading. Hey, MSNBC fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there and click on any of the videos here to watch the latest interviews and highlights. You can get more MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.